Hello students, welcome back to the next module of this chapter. Now today in this module we would be learning about types of kidney failure. Now my friends, kidney failure or renal failure is classified in two basic categories. The two basic categories are, the first category is called as the acute kidney injury, which can be also abbreviated as AKI. That is also known as acute renal failure. And the other type of kidney failure is chronic kidney disease, which can be abbreviated as CKD, or it can be also termed as chronic renal failure. So these are the two basic categories of renal failure. Now my friends, how to differentiate between acute kidney failure or chronic renal failure? So basically we have to perform a very simple blood test, and that blood test is called as serum creatinine. By taking the observations or by taking the findings of serum creatinine from the patient's blood, we can isolate or differentiate in two types: acute renal failure, that is acute kidney injury, or chronic kidney disease. Let's see what are the other tests or other signs which can also help to differentiate acute kidney injury or chronic kidney disease. Now my friends, in chronic kidney disease or chronic renal failure, there is a decreased production of RBCs. So the patient will be having anemia. And if you also see the USG or the ultrasonography of the chronic kidney disease patient, the size of the kidney is also reduced. So these are the two signs which can also help to differentiate between acute kidney disease and chronic kidney disease. So along with serum creatinine and doing blood tests and checking the sign anemia, and also by seeing the size of kidney on the ultrasound, we can differentiate between acute kidney disease or acute kidney injury and chronic kidney disease. So these are the differentiating factors which can help us to differentiate between acute kidney injury and chronic kidney disease. Now let's see in more detail about acute kidney injury and chronic kidney disease. Now here we are doing a comparative study of acute kidney injury and chronic kidney disease. Now my friends, both of these diseases are basically kidney disease. Now what is happening here? There is renal failure, that is loss of renal function. Now if you think in more detail, basically there is a loss of functioning of nephrons. The kidney is not able to function properly. But what is the differentiating factor, the two words acute and chronic? Acute kidney injury, here the renal function loss occurs at a very higher rate within a short duration of time. But if you talk about chronic kidney disease, the renal failure occurs at a very long period of time. It occurs gradually within years or months, where chronic word itself suggests which continues for a very long time. Now let's see what are the causes of this disease. If we talk about acute kidney injury, the first cause is the pre-renal cause, where the cause is lying before the kidney. As if you talk about the blood supply, if there is reduced blood supply to the kidney, absolutely the filtration rate will reduce. The glomerular filtration rate would be affected, and that will cause the reduced renal function. Or the next cause, that is the intrinsic cause, where the cause is lying within the kidney itself. There may be any infection, tumor or stone present in the kidney which is affecting the renal function. Or the cause may be lying outside the kidney, that is the urinary obstruction, such as a tumor, stone or infection present in the ureter or the urinary bladder or urethra. So basically, acute kidney injury is classified in three types: pre-renal, intrinsic and post-renal. But if you talk about chronic kidney disease, the first cause is irreversible acute diseases, which leads to chronic kidney failure. The other diseases such as diabetes mellitus and hypertension, that is high blood pressure. During this disease progression, what happens? There is a lot of pressure on the kidney itself. That's why if the patient suffer from this disease at a very long time, there would be development of chronic kidney disease. So these are the causes of acute and chronic kidney diseases. Now let's see what are the symptoms of acute kidney injury and chronic kidney disease. If we talk about symptoms, my friends, what is happening here? There is a loss of renal function. What is the basic function of your kidneys? They make urine by filtering your blood. So basically, the first symptom would be oliguria, that is reduced urine production. If you talk about in adults, there is reduced urine formation at a very slower rate, that is less than 400 ml per day of urine in an adult. If you talk about in a child you can see or observe less than 0.5 ml of urine per kg per hour. And if you talk about an infant, the urine rate is of less than 1 ml per kg per hour. And what are the other symptoms? There is a lot of body water and fluid disturbance. Since there is very reduced urine formation, what is happening? There's a lot of fluid overload inside the body. So there would be a lot of swelling seen over the body, and as well as electrolyte derangement. But if you talk about symptoms of chronic disease, here as the disease itself develops at a very slower rate, the symptoms are very less compared to acute kidney injury. Now let's see what is the treatment. So to treat acute kidney injury and chronic kidney disease, let's see the treatment. If we talk about acute kidney injury, this disease, acute kidney injury, is a reversible kidney failure. After identifying the particular cause, the kidney functions once again come back to normal. But till the time the diagnosis is done, we can bridge the time gap with the help of dialysis. So till the time there is no diagnosis, the patient can be assessed with the help of dialysis. And if you talk about chronic kidney disease, here the renal replacement therapy is required, either in the form of dialysis or renal transplant. So this is the treatment of acute kidney injury and chronic kidney disease. So that's all for this module, my friends. Today we studied about types of kidney failure. In the next module, we would be learning about dialysis. Till that time, take care. Thank you.